Hello friends, welcome to Creative Medicine. In this lecture, we will learn about systemic vascular resistance is twice that of normal. Treatment should be sodium nitroprusside. Here systemic vascular resistance, increased systemic vascular resistance means there is vasoconstriction. So you should give the patient a drug which causes vasodilatation. Which of the following drug reduces the blood pressure primarily by decreasing the heart rate alone? Propranolol decreases the heart rate and is used in reducing the blood pressure. It has negative inotropic effect. Next, antihypertensive that causes decreased libido and impotence is atenolol. Actually, if you see first diuretics, they have maximum risk of sexual dysfunction, followed by first diuretics, second beta blockers. But because in the options diuretics are not given, we have to select this atenolol. In the beta blockers again atenolol, and we have carvedilol, and we have metoprolol. All these have high risk of erectile dysfunction in the patients. Then, thank you and thank you for watching.